otimo bero mare mokwongo mar nyarogno igimanyiso kang makoro ute thieth mapacho ka osegoyo. Bero makamano notim ne jotuo 4 kama oting'o jotuo nyarogno 2 kod joma nochiwo negi nyarogno bende 2 manotimre tarik 7 kod 8. Ji 4 go sani pod nitiere od thiethno ka irango chal mar ngimagi tok bero. Od thiethno bende koro bedo od thieth mar 3 mar piny owacho e timo bero makamano tok od thieth ma Kenyatta National Hospital kaachiel kod mano mar Moi Teaching and Referral Hospital. Jatatiche od thieth ma Kenyatta Dr. Zainab Gura olero ni tok bero makamano jatuo mar 3 kod jachiwne nyarogno oseiki ne bero makamano ka jomoko 4 bende rito thieth.
Who was able to receive a kidney from a 47-year-old lady. The transplant that was done yesterday was a 47-year-old lady who was able to receive a kidney from a 50-year-old man. These people, these pairs are related and they are doing well.
It is an indication of service provision, progression of service provision, quality of service, and being able to now transition that patient from dialysis to receiving a kidney and doing well since the surgery was done on 7 is clearly a mark of quality services provided in this facility.
We discussed with the CEOs of all the referral hospitals. We are targeting that within 1 year we could do up to 200 transplants, and then look at how to scale that up to other hospitals as we make sure that our systems are okay, the donor management issues, the recipient management issues, the hospital systems in terms of the theater conditions, the availability of medication for post-transplant, and we are very keen to make sure that we are moving progressively.
Sirkal mapacho ka dhi duoko piny nengo mar thiedho tuo sukari kod atamalo 50 kaka achiel kuom yore mag kedo gi medruok e kwan jogo manigi tuono e pacho ka. Kalure kod jagoro mongirore migawo mar thieth Laktar Ouma Ologa, nengo mamalo mar thiedho tuo sukari en achiedh nade maduong' ma jotuogo yudo. Owacho ni migawo mar thieth tudore kod kembe maloso gige thiethgo tuo sukari kod yedhe mondo oduok piny nengo mar thieth. Oluga bende manone piny Kenya nigi jotuo sukari 800 ka jotuo atamalo 54 pok opim. Gino manomiyo idwa duok piny nengo thieth ni mar onyalo konyo e ting'o malo kwan jogo mipimo ne tuono.
We have the NCD strategic plan for the Ministry of Health under which diabetes comes, and we are very keen to work on what we call access programs, and we are working on access programs across the board, but 4 things that are important for us. One is among the non-communicable disease, diabetes is key because of the cost of the medications. We want to reduce the cost of medications by around 50%, and we are working on an access program where the Ministry of Health will take lead in engaging with manufacturers of diabetic products and diabetic medicines so that then we can make this across the private and the public sector a reduction in the cost.
We have community health promoters and we are training them in terms of educating them with regards to non-communicable diseases. So they go out of their way to screen and then appropriately refer to the health facilities. Our mandate at Kenya Diabetes Study Group is to train these healthcare practitioners. Now, if we can be able to ensure the Kenyan is actually screened and diagnosed at the right time and then referred timely, we can reduce this economic burden.